Welcome to the RevMD podcast with me, your host, Dr. Debra Durst, and my co-host.
Hey guys, Faraday Goli, board certified family nurse practitioner that works alongside Dr. Durst at RevitalyzeMD.
So I am traditionally trained, and I branched out into regenerative medicine in 2017, and so we have been building up a practice, and a busy one at that, because again, we comprehensively treat in non-traditional ways. So something that might not include meds or surgery, of course we can do that if we need to, but patients are usually looking for something that they can't get elsewhere, because they want more non-traditional options, and they aren't looking for meds options. And comprehensive, not looking for medicines and surgeries. And we've been saying all along that patients are more proactive in this area than physicians and providers. So they sometimes have trouble finding an office that fits. And so it's very important for us to have a place for patients to go to get the treatments they need, and to even, meet with somebody that can comprehensively address what they're going through as they're noticing changes.
Yeah, even if that's a mix of traditional and non-traditional medicine.
Yeah, so this in particular, we're talking about vaginal laser treatments for women and urinary incontinence treatments. And this is something we do on a daily basis with patients. It's life-changing for patients, and we basically hear that on a daily basis, right?
And unfortunately, this is an area that traditional medicine has not done a very good job in treating women in.
Yes, correct. And we have done multiple podcasts on incontinence overall, because it's not just with women, it is with men too. And worldwide, 423 million patients with incontinence.
And 13 million here in the U.S.
In the U.S., yeah. And very few of them treated, basically. And when you look at traditional offerings, which were updated in the American Urologic Association and the NIH on 2023, is that it didn't involve any regenerative treatments. It was talking about, again, things you can do yourself, giggles, being one of them. Basically,
it sounded like you said giggles, but you said
Kegels. Kegels. I said it fast. I do have a cold. She's been making fun of me then, right?
So not giggles.
Yeah.
Kegels.
Kegels. And basically, you never know with me with this. We live in East Tennessee, and it's beautiful and very lush, but it is also pollen filled about this time of year. So, but basically, it talked about injections, Kegels, or basically surgeries, and those surgeries most commonly being slings, and even the percent of patients getting that had decreased significantly. And so what we're looking at is alternatives to that, and regenerative treatments, and vaginal laser treatment being one of them, O-shot potentially being another. And those are things we do in the office, and we comprehensively address that from even just a root cause. But this one is laser treatments, stress incontinence, and an erbium treatment, which is, again, an erbium vaginal laser treatment. Typically, erbium can be ablative, which means you're taking the surface layer of tissue off, but our erbium vaginal laser treatments are non-ablative. They're in office, no pain, no downtime, and you are surface heating to communicate with the tissue that there's an injury there to get repair and help with incontinence. The nice thing about it is it doesn't just help with incontinence, right? It helps with lots of different functional things. So,
yeah. And today, we talk often about wanting to look at studies and bringing up studies and bringing that clinical side, that research side to clinic, and where these protocols come from. So today we're going to look at a study that is about functional sexual function and vaginal changes with vaginal laser, specifically for women in stress urinary incontinence.
This one is exciting because this one had some imaging that was involved in the study. And so they
can't
also
fake the numbers, and when you see that change.
I love when there is actually objective data, and ultrasound is a great thing to have there. So basically with this, they treated 50 women, And they were treating stress urinary incontinence, like Faraday said, with erbium non-ablative, and looking at an ultrasound in the perineal region that measures the vaginal canal. And it measured it throughout the length of the vaginal canal.
Yep. And they were looking at assessment pre-treatment and then 6 months after treatment. So that's a pretty good time frame.
Yes, yeah. And remember, they're treating incontinence. So they're seeing about improvement there, but they just happened to be taking a look at the anatomy at the same time. And what did they find? They found that there were anatomic changes. So basically, they found that 74% of women had improvement of their stress urinary incontinence. That's huge.
Huge.
Yes. And so that is important. And basically, they just did one treatment with
I was going to
this.
say, did this one specify? So typically in clinical practice, we are doing 3 treatments, but this one was just one treatment.
And it's actually was 220 women with the ultrasound. And the results from a symptomatic stress urinary was 74% of women got improvement, and this was one treatment. And then basically they had functional improvement in the FSFI, which is the sexual function scoring. But the most exciting was the ultrasound findings that showed that they had shrinkage of the vaginal canal. And so they actually measured, and that improvement was across the board in the entire length of the vaginal canal, from proximal to mid to distal, with improvement, shrinkage, and tightening of the vaginal canal seen with objective ultrasound and measured with that. And so we'll attach the study in the description. But that's exciting. So not only did they get improvement of their stress urinary incontinence, they got improvement in the sexual function, which could have also been related to a tightening of your vaginal canal. And all of that from a laser treatment that didn't involve any medications and no surgeries.
That's pretty exciting.
It's exciting, but
I love that they have the images and that you can really see that before and after.
Well, I think that I want Faraday to bring up a recent experience. We'd like to, again, talk about the science, how we apply it, and we do this laser treatment in the office with improvement of all those things. So we have husbands, when they hear that the tightening is the case, that, we'll recommend wives that come in. And usually those couples are very open about, sex and discussions. And so it's not as if they're ever offended. They actually want the treatments too, because they want to improve all
And then
things.
we get them in the office, and they usually do have other things going on. They do have urinary incontinence. They are perimenopausal or menopausal, having some vaginal atrophy, having some dryness or pain with intercourse. There's a lot going on there.
Orgasmic issues.
Decrease in orgasmic strength. So what Dr. Durst is talking about, so a lot of our experiences are from, clinical practice.
Yes.
So recently it was brought to my attention that in other countries, you can do filler, hyaluronic filler like you put in your cheeks, into the anterior vaginal canal to help with tightening.
Yeah.
That blew my mind. I had never heard of that. That is not something that I found done in the U.S. I had a hard time finding it even out of the country, but I did find a website about it, a particular practice out of Russia that had it on their website. But there's no need.
Yeah, when it comes to
It's
injections
crazy.
in the vaginal, or injections in, again, the vaginal area, the female genitalia, the male, if
Filler
there's
in the vaginal
studies,
wall,
there's other
Deb.
people doing it. And so, of course, she brought it up to me, and I was like, well, I'm not doing that. And, if we found studies, and it would have been interesting just to look at, but there's no point in doing an injectable that tightens when laser treatments do it. That's the main reason.
Safely.
Yeah, you have other
They do 'em
alternatives
safely.
that are safely doing it without injecting a foreign.
And it's natural, and the body can do it on its own.
But that was very interesting. She's like, did you know that they are doing this?
That you can do this. And she's like, I'm not doing it. And I'm like, I'm not talking about you doing it. I'm just saying that this is occurring.
Yes, I had no idea. And how many syringes did she have?
6.
Yeah.
6 syringes.
Yeah. So, and again, we're talking about filler that is used for penis girth and enlargement, and that is pretty commonly used.
And you can use it in the labia majora for to help kind of give a little bit more suppleness to the tissue to fill.
Correct.
But I've never heard of internal.
Correct. No. Well, I had not either, and had definitely not heard of 6 syringes.
6 syringes.
That's hard to even hear that sometimes in the face when
It's a
patients
lot.
talk about fillers. So that was interesting. And this lady actually said she would do it again too, but probably not after she gets vaginal treatments with us, because this is another regenerative way to tighten without injecting anything. So, but this was interesting. Again, improvement in stress urinary incontinence, and it actually was a total of 220 with the stress that were treated. And I think just complete data was on, including
50.
the ultrasound, was with 50. And so that's when you had the tightening and improvement in sexual function. So that's exciting. And again, I think that regenerative treatments, because if you're looking at incontinence, you're talking about injection, surgery, you don't get the functional improvement across the board, which is improved blood flow, lubrication, decreased pain, increased orgasmic strength, and tightening, as you can see here, and then improvement of incontinence. So you get all of those things with the regenerative treatments, and we can also comprehensively address it from a root cause, which sometimes is hormonal and aging. So if you've had any experience with vaginal laser treatments, let us know. Leave us some comments on your thoughts. Let us know if you want to hear about anything else, because we are willing to deep dive into anything wellness or sexual wellness or
Anything.
anything. Thanks for listening.